Determining what dates to place in the work list will depend on the purpose of the work list. If you need to action it right away, leave the date set as today's date, both the start date and the due date, and this is what it will default to when creating a new work list. If you have completed all the action you can take for today, but the work list is not completed, leave it as in progress, but consider changing the due date to 2 days from now, or the next day that you wish to action it. Double click in the due date field. It opens the calendar. Select the date of choice and then click on save. And then as you can see, it has changed the due date to black from red. So the red work lists are overdue work lists that need to be actioned on today or as soon as possible. If the due date is black, it means that it's not necessarily due until a date in the future. This is going to be helpful for prioritizing work. Obviously, the urgent work list is going to take priority, and it will always appear at the top of your list. But there's also other work lists that are showing as overdue. So the red due dates are the work lists that you're going to prioritize. Work lists are also helpful for future reminders. If needing a reminder in the future, whether it's 3 months from now or 1 year from now, consider creating a work list and changing the start date and due date to the date that you wish to be reminded. So this patient is due for an annual PAP in January 2023. We can change both start date and due date to the date that we wish to be reminded. And as you can see, this is going to help prevent a patient from falling through the cracks, but also will not clog up your pending and in-progress work lists. It is in a separate work list status altogether as future tasks. So once the start date of January 12th, 2023 comes around, it's automatically going to move this work list into the pending work lists, and then it will show up as a red due date, suggesting that action is then required, and then you can continue using your work list as usual.